Hi guys, it's Brooke here. I have a super quick favor to ask. When you have a moment, please take just a second to give this podcast a 5-star review. This will help me to continue the podcast and continue to bring these resources to the community. Thank you so much for that 5-star review.
So Leucovorin was, the FDA did approve it on label for cerebral folate deficiency. So there was a lot, that's when this whole buzz started. The FDA talked about it for kids with autism, but they did not, so it's been off label for autism, but used for years for kids that had the folate antibodies, on label for cancer as a cancer rescue drug. So when chemotherapy wipes out your folate, it can be restored with this high dose folinic acid. So it's been approved by the FDA and used for many, many years, but not for autism. And so then it was mentioned by the new administration that it could be helpful in autism. And that is what started everybody hearing about it and thinking about it. But then the FDA never approved it for just autism. So they approved it for the cerebral folate deficiency that can result as a result of antibodies, but you don't know unless you do a lumbar puncture.
Hey there, it's Brooke, and welcome to Finding Hope on the Spectrum, where I have heart-to-heart conversations with parents, professionals, and autistic individuals sharing personal insight and life experiences. Together, we dive deep into supports, programs, and stories that offer inspiration, insight, and most importantly, hope for the neurodiverse community. Before we begin with today's topic, please take a moment to like, share, and subscribe to this podcast. And if you know someone who this would be helpful for, please pass it along. Remember to always stay curious, be kind, and have an open heart.
Okay, well, I am very excited about our conversation today, and I have Dr. Lisa Loegering returning a second time, and we are going to be going into a much deeper dive into leucovorin and gut therapies and also some medical supports. So Dr. Lisa Loegering is an integrative developmental pediatrician who focuses on treating patients with autism, anxiety, and ADHD. Her pediatric and developmental training was done at UCLA School of Medicine, and she's a certified functional medicine doctor through the Institute of Functional Medicine. Dr. Lisa's practice is located in Del Mar, California. So welcome back, Dr. Lisa.
Thank you. Thank you for having me.
I really appreciate it. I've been having interesting conversations lately with people about leucovorin. It seems like it's all the buzz in our community these days. And so I'm excited.
Yeah.
So let's start with leucovorin. So what is leucovorin and how does it differ from standard folinic acid or folate supplements?
So folinic acid is the reduced form of B9. So it's a B vitamin, but we say reduced form, it's an activated form. So if you go, for instance, to buy a folate supplement, and you just look or you're buying a multi and you're looking for, does it have B9 in it? It might come in the form of folic acid, which is not the activated form. That's sort of the old form that is still put in lots of multivitamins. But because of certain genetics that many of us have, especially kids with autism, they do not use the folic acid as well. And so then there's methylfolate, which is another activated form. But then there's folinic acid, which is a second activated form. And if you go, I'm trying to make it not too complicated. I'm probably making it more complicated, but I want people to understand, like when they go to look for things, they're going to see these various forms because you can actually buy all three forms. You can buy folic acid, you can buy methylfolate, or you can buy folinic acid, and it's the folinic acid that is the leucovorin. The folinic acid that you buy online or in a store is somewhat the same as the leucovorin, which is just a form of folinic acid. However, it's lower dose if you buy it in the store. You can't, so many of the forms, you would have to use half the bottle. So they don't make it that concentrated. So you might go through a bottle in, a few days to try to get the higher dose. So the reason people have it prescribed is that the pharmacy can make it in high dose. Mm-hmm. So does that make sense? It's folinic acid in order to be effective for what we're trying to treat in autism has to be high dose. And so it would be, too many pills or too much powder if you're just buying it over the counter. However, you could start on a lower dose and do that. So it's basically the high dose form of a B vitamin that's available over the counter in a lower dose.
Yeah.
Is what folinic acid or leucovorin is.
Mm-hmm. And I know before you mentioned compounding pharmacies and the benefits of that. Can you speak a little bit more about why that's the case and why that's a lot of our clients go to compounding pharmacies as well to get leucovorin?
Right, the compounding pharmacies make a pure product. They just use folinic acid. My patients, they have it put into capsules. The capsules they open, and the dose is in the capsule. They can dump it into orange juice or, into some food or drink, and then the child can drink it. If you go through a commercial pharmacy like CVS, it only comes as tablets. The tablets also have additives. All pharmaceuticals will have some binding agents, and I've been told that certain brands of leucovorin have lactose, a dairy product that we don't want the kids with autism on, or some are sensitive to that. And so if they go through CVS, they are going to get it in a pill form, which some people can grind. The older kids could swallow, but there'll be these additives that you can't, that they just come with the pharmaceutical. And then when I talked to the neurologist who did the studies, Dr. Fry, he just said he prefers to use a compounded version because some kids get more irritable with the non-compounded version. And so you don't want to give up on the treatment because you're reacting to an additive that you didn't even know about. Now, in my mind, the price difference is quite significant. So the leucovorin might be a couple hundred from the compounding pharmacy. That might last a couple of months, the amount, depending on the dosing and compounding pharmacy. But at CVS, it might be $5 if you have a copay and insurance that's covering it. So that's why people will choose to go with CVS. And it's not unreasonable to start with that, but you should not decide that this is not for your child until you've tried the compounding version.
Yeah, that makes a lot of sense. And so how does a family decide that they want to try leucovorin, or how do you decide if a child is a good candidate to try it? And is there testing, or what is the process?
Well, so the one test, if you want to collect more data, which is always a good thing. And eventually I tell families, even if you don't want to collect the data now, we need to collect the data at some point to decide how long the child's going to continue on the leucovorin, or do we need to go to a higher dose, or, we just need that data. Some families, they don't want to do the blood test. So it's called the FRAT now, or the FRAT test. It's fratnow.com, I believe is the website. So you can order a kit, although a practitioner has to be the one to order it. The family can actually start the order and have the permission to have the kit sent to their doctor, so they can go to the site of the kit. So there's one company in the US that does all of the testing. It takes a couple months to get the results back, and that company is looking at the blood for binding or blocking antibodies to the folate receptor in the brain that transports folate from the blood to the brain.
Mm-hmm.
So if you're positive for that, you have there's a pretty good reason to think that you might get benefit from the leucovorin. However, some practitioners are treating all kids with autism, giving them a trial without the blood test. So leucovorin the FDA did approve it on label for cerebral folate deficiency. So there was a lot. That's when this whole buzz started. The FDA talked about it for kids with autism, but they did not. So it's been off label for autism, but used for years for kids that had the folate antibodies, on label for cancer as a cancer rescue drug. So when chemotherapy wipes out your folate, it can be restored with this high dose folinic acid. So it's been approved by the FDA and used for many, many years, but not for autism. And so then it was mentioned by the new administration that it could be helpful in autism, and that is what started everybody hearing about it and thinking about it. But then the FDA never approved it for just autism. So they approved it for the cerebral folate deficiency that can result as a result of antibodies, but you don't know unless you do a lumbar puncture, which in the studies, many of the kids did have lumbar punctures, but not all of them, although all of them, from what I can tell, had the folate antibodies in the studies that were given the leucovorin. So basically, we're using it off-label for just autism, and the Academy of Pediatrics came out and said there's not enough evidence and that you shouldn't use it for that unless you have the LP, but that would involve sedation. The kids with autism are usually very squirmy, and they would have to be sedated. You can't do an LP. It's going to be more invasive than a blood draw. Blood draws, you can pin them down and still get the blood. The LP, they really can't be moving and thrashing. So, right. So it's going to be hard to get if they're not cooperative. Right. So basically, now most of the kids who are trying leucovorin are not getting lumbar punctures, and I don't even do lumbar punctures in my office. So it would have to be a hospital procedure. So it's not very accessible. So basically, with the autism community, then people are wanting to try it because the studies that Dr. Fry, who's one of the neurologists that is an expert and has written a book, The Folate Fix, so has been doing studies for several years on kids with autism and folate antibodies and treating them with leucovorin. He had, indicated that 2/3 of the kids got better with the leucovorin in his studies. And that's there's not a lot of things that will give that result. And right. And there was not a big downside. So some of the kids got hyper. That usually went away after about 6 to 8 weeks, but otherwise there were not serious side effects, but there were good benefits. So of course people want to try that. The other thing to note, there's not a whole bunch of medications that work for autism. The only other one approved, or there's, I believe, 2 antipsychotics approved, Risperidol and Abilify, but those are approved for irritability, and they don't necessarily help with cognition and language. So and they're, and kids can have side effects, basically weight gain, which can then lead to diabetes.
Yeah.
So they help with certain symptoms. And if you need them, you need them, but there's not any drugs that actually help with the core symptoms of autism plus language. Now, there are therapies, and Leucovorin is not to take the place of therapy. It's not meant to take the place of therapies. What we, as autism doctors, what we try to do is make the kids' brains healthy and make them focus and make them their cognition better so that they can get the most out of all their therapies. So all the kids I take care of, we make sure their school setting is good. They're generally in ABA, they're in speech therapy. So it's not to take the place, it's to make those therapies work better.
Yeah.
And so Western medicine in general offers all the therapies, and that's great. But on the drug front or pharmaceutical front, there's not a lot.
Yeah. Yeah. That makes a lot of sense. And when you said these kids have cerebral folate deficiency, is that the term that you used?
Right, because that's the term that the drug is approved for.
Okay. And what does that mean to have, and what are the symptoms of that if you have that?
So that means that your brain doesn't get the folate. And even if you are eating a great diet or, taking your nutrients, you would have enough folate in the blood. Well, the folate level in the blood is not what we're talking about. I only mention that because a few people come to me with labs, that show the pediatrician might have done a folate level and then said that they were fine. But the folate in the blood does not reflect necessarily what's in the brain. So a certain number of kids make antibodies to the folate transport system. So basically you have the folate in the blood, but it does not get into the brain. So the antibodies, like think immune, we know that kids with autism have inflammation and its autoimmunity is not a far-fetched idea that they would have that. Right. So in fact, we document they have these antibodies that then prevent the folate from getting into the brain. And the leucovorin is a high dose folinic acid. And we found that if you high dose the folinic acid, it can use another pathway and get into the brain.
Oh, okay.
And so we're trying to get, the brain needs folate, basically. And so what are the symptoms? Autism, regression, seizures occurring at an early age. So that's why people are eager to try it. But there's a few things that I would want parents to know is that it's best used with a few nutrients added. So we usually will add B12. The neurologist would prefer that be in the form of shots to really get the dose high. The high dose leucovorin could cover up a B12 deficiency, which if you're not getting blood work, you wouldn't see that. Like if you have a kid that the parents say they won't cooperate for blood work. So I just add methyl B12 in the form of lozenge or drops for every kid that's on that, or preferably shots. But if they won't do the shots, then I will do kind of a higher dose oral form. So the B12, a little extra riboflavin, which is helpful for methylation. And when I look at other testing, I always find the kids seem to need more riboflavin, which you can buy in a capsule and just empty into, whatever drink that a child is getting. A lot of the kids are low in what we call mitochondrial support. And so CoQ10 or ubiquinol is the active form of CoQ10. to add a little bit of that, a little bit of acetylcarnitine. I know this all sounds like a lot, but I just wanted to say that in order to get the leucovorin to work the best, to add a few of these other nutrients would be helpful. And some of the multivitamins actually have pretty good doses of that. So like I have the kids use Spectrum Needs from neuroneeds.com. I have no connection to the company, but it has everything. Like it has high doses of riboflavin. I would just add the B12 to that to get those doses higher, but it has the mitochondrial support as well as some good B vitamins. Just needs a little more B12 for the leucovorin. So, and it has the dosing, on the website. So you get that from neuroneeds.com. Okay, and I just found that it was a good multi. I actually have all my kids that I treat start on that. So it's, that no real side effects. If you're sensitive to B vitamins, sometimes we have to lower the dose because of all the B vitamins. They might get hyper, but there's no bad side effects.
Okay. Yeah, and we can include a website in our show notes too. So that sounds great. And are there any side effects for leucovorin? I know you mentioned it, that there weren't too many, but are there any?
The hyperactivity. And then people will say that we really haven't studied it over decades. And I did for cancer, most of us that do autism with peds, we don't know that much about cancer treatment, but as a rescue drug, it wouldn't have been used for decades because people get chemo for months. So it would have been more on and off for months.
Right.
So that is correct. However, there's a form, it's used, Deplin is methylated folate that's used as an antidepressant, and people are on that for decades. And I haven't heard of bad side effects reported. And that is a higher dose. It's a slightly different form than Folinic acid, but people have been on that for a long time without problems. So I'm not aware of any serious side effects. Mm-hmm. I think that because the studies, looking at the studies, they're well done, but they're from 4 different countries, so not just one person. Mm-hmm. A total of about 350 kids were studied. There are randomized controlled where they do, one group gets the leucovorin, the other group gets something that's not active, but nobody knows who's getting what. Because there's always something called placebo. So there's always something, if you are doing an intervention, that just the fact that somebody's participating in an intervention could just make them better. Mm-hmm. And so we have to be careful to make a judgment about that. But in this case, it seems like the results have been replicated. It's smaller studies. So what the main Western medicine wants to see is thousands of kids, not a few hundred.
Right.
But that I don't know that that's even being done. I didn't see large, thousands of kids being enrolled in studies. So I don't know if that data is going to come out. Doesn't seem like that's going to come out anytime soon. Yeah. We do know that leucovorin seems to be more effective when it's used at younger ages. So the dilemma that parents are having is that they want to have the leucovorin, but nobody's willing to prescribe it. The pediatricians are not prescribing it generally. And some of the neurologists are, but not everybody's under the care of the neurologist, and not all of them are. So just some of them. And so then there's autism doctors like myself, and we are prescribing it, but not everybody has access to, because most of the autism doctors are not in network. They're out of network for insurance. So not everybody can go. Yeah. So that's the problem that I've seen.
Probably just going to take more research to get to the level where it's out there more general.
But it could be a decade though.
Yeah. Yeah.
And by then kids that are 3 would be 13. So people don't want to wait.
Right. Right.
And if I were a parent, I wouldn't want to wait either. Now, Leucovorin it's not the one-time magic pill that's, with autism it's like a puzzle. There's many things that are not working well, and you really want to fix everything. You don't want to put all your eggs in one basket. However, we are finding, if you have the antibodies, that is seems to be a big intervention. But I still wouldn't not fix other things that I see. So if for instance, most of the kids need zinc, and it's a whole different mechanism. They have a weak enzyme that regulates zinc and copper. They're super low in zinc and often high in copper. This creates poor focus, ADHD-like symptoms. You give them a bunch of zinc daily and they get better. So you would want to fix that. You want to look at the microbiome. Some of them have chronic constipation, back pain, irritability based on that. So you want to look at that. You want to make sure they're eating real food. They're restrictive eaters. You don't want to necessarily just give Leucovorin,
right,
but let them eat, their 5 foods that are all gluten and dairy every day.
Right.
So I still say you fix everything you see. And Leucovorin now is great that it's one big thing that if your child is one of the ones that has those antibodies, there's a greater than 50% chance they're going to improve.
Yeah. Just huge. Yeah. And a lot of those things that you just mentioned, we talked about other episodes. So if our listeners are more specifics on those, we definitely go into more detail on all of those areas. And that was a great episode to learn about those things too. And I'm glad you mentioned that because I know we're talking about Leucovorin, but there's so many things that you do in your practice and, really step by step help these clients figure out what's going on and what those challenges are and treat them, one at a time. So I think that's great that you mentioned that. And one of the things that you had shared with me before, which I was really curious about, is these gut-based interventions and fecal transfer. I had never heard about fecal transfer before. And so I'm really curious. And then after you mentioned it to me, I saw it online that all these moms were wanting to know more about fecal transfer. And I was like, oh, this is something people are talking about. So we should talk about it. So
right. And I was actually hopeful that I would find more information about it. And that is what gets discouraging. And there are a lot of trials going on now. It's like there's all these cool things, but then there's just not quite enough data. And the reason too with the Leucovorin, we probably, we should talk about it every few months, is that it's such a big thing. And if people can't get it or they're, I just think it's good to keep bringing it up because they're not going to necessarily get it from their pediatrician. So they're going to have to advocate. So they need to know about it so they can advocate, for their child. But back to fecal transplant. So now there was a study by Dr. James Adams in Arizona, and he's at the University of Arizona. So he is the main U.S. person that I'm aware of, and he gives lectures at our autism group, the MAPS group, which is part of the TakaNow.org, is a parent part of that group. Mm-hmm. So he probably has done talks to the parents also. So he did do a study where there were 18 kids and they got fecal transplants, which you wipe out the bacteria. It's a little more invasive than some other things because you wipe out their own bacteria and then you replenish it with transplant, microbiota. And so he did that, but there was not a placebo control. It was called open label. That he did track that a fair percentage of the kids with autism got better over 2 years. in terms of their core autism symptoms. But the criticism was there was not a placebo group. And then some other groups have done small studies and they haven't necessarily found as good of results. And so we're waiting on a placebo-controlled study. Now, there are a whole bunch in the work. So with that, it does appear that a lot of researchers have registered studies, and I know Dr. Adams is trying to get the procedure approved for autism. So it's basically approved for C. diff colitis. So if you have like an ulcerative colitis type of situation from a specific organism that is resistant to antibiotics, you can get this procedure in the US. But you can't get it just if you have autism, unless you're in a study. And now it is available in other countries, although I'm not sure where it's being done right now, which other countries. But it has, so the evidence is with just trials that are not considered the gold standard, and they're very small. And there's a little more risk because of wiping out your own bacteria before replenishing it. And so, the medical establishment has not jumped on that.
Yeah, that makes sense. And how do you wipe out your bacteria? What does that look like?
Well, certain antibiotics.
Oh, okay. All right. And do you know how long that takes? I'm just very curious how this goes.
Yeah, I don't know the procedure, but I don't think it's I think you're on probably fairly high dose antibiotics. I shouldn't say, I have no idea.
Yeah.
But anything that does that is, clearly there could, and I don't think there was any like serious side effects from the Dr. Adams study.
Yeah.
But you're opening the door for more things.
Right.
Because you are using the antibiotics.
Yeah, for sure.
So I think on that one, I would say we're waiting for more data.
This show is brought to you by Therapeutic Approach to Growth. Therapeutic Approach to Growth helps families with relationship and behavioral needs. Their holistic programs are individualized to honor and respect each family and their autistic son or daughter's sense of self through programs such as relationship development intervention, naturalistic ABA, and animal-assisted services. If you're finding yourself frustrated or discouraged with your current behavioral programs and would like to see more long-term meaningful growth for you and your family, then contact TAG today at www.tagforgrowth, that's TAGFORGROWTH.com, to learn more about how to schedule a consultation or how they can offer you the help your family needs, whether in person, remotely, or in a school setting. Again, that's www.tagforgrowth.com.
Yeah. Well, it's exciting, though. It's an exciting, time to see the research and what people are looking into.
Right. But I do have some ideas for parents, because I listen to lots of podcasts, and I really like it when I learn something or like I have an action item, rather than just information that I can't really do anything with. Like, it's great, but I can't even get the product that's being talked about. It's not even available. So this is what I would recommend for parents. And this is what we as autism doctors are doing, is we are looking at the microbiome. And there are bunches of studies going on where they're looking to see, do the autism kids have a microbiome that's different than neurotypical kids? And they are seeing that there are differences. Now, that's still, there's some criticism of the study, so not everyone's buying that, but there's quite a bit of data. And we are finding that there's less diversity with autism microbiomes. There's certain overgrowth, growth of certain bacteria that can cause more problems, like constipation, or like they don't have as much of certain bacteria that are good, and they have too much of other bacteria that are not good. And so there's a newer company, but very reputable, called Tiny Health. They do sell to consumers. So have you heard of the Tiny Health? It was started by a pediatrician.
Okay.
And I actually haven't used it yet, but I think I may start using it on patients. So basically, the good thing is they're reputable. You get results that tell you what your child is low in, or what their microbiome's doing and what they need, and you can order it online. And it's called Tiny Health because it was started by a pediatrician, so they take into account that a child might be a 3-year-old, not an adult. Most of the other tests have been geared toward just a standard microbiome and not age adjusted. So I think that would be a good start if somebody wanted to work on the microbiome, is to get that test, and then they tell you what you need to do. And one pearl that I learned is that if there's certain probiotics that would help, your gut make the right bacteria, if you use the probiotic capsule to make yogurt, but maybe coconut cream, not dairy, because most of our kids are dairy free, there's more change in the microbiome than if you just take the probiotics. So the big thing about probiotics has been that they're like tourists, they're passing through, but they don't really stick. So they can induce good changes while they're in your gut, but then they leave.
I see.
So a way to get them to stick more is to actually make yogurt or some, fermented food with a probiotic. So and you would make it with the probiotic, for instance, that Tiny Health might recommend.
I see. And that's pretty straightforward. You'll go online and find a yogurt recipe to make.
Well, so I was getting my information from Heather Way. She's in Australia, and she has a bunch of videos, and you can look her up online. She's part of our autism group. And what she recommends, which I haven't tried yet, but you use coconut cream, which is about 70%, or so if it's 100% cream, you might add a little milk. You basically have to put a teaspoon of sugar for the bacteria to eat, and then your probiotic, mix it all up, put it in a yogurt maker, and then it's done whenever the yogurt maker says the yogurt is done. There you have it.
Yeah.
So a day later or so. So I just think that's something that would be really good for parents if they knew the probiotics that their child needed, and then they could make food out of it. It would have a stronger benefit.
Yeah, that's a great tip. I didn't even know there was such thing as a yogurt maker. That's great.
Yeah. And you might have to. I've had one. I've always never been successful. Like my yogurt's too runny, or I don't know, something happened. So it might take a little bit of looking, but I'm going to retry this whole thing, because I think you can also flavor things so that your child would like it. So you have a picky eater.
Yes.
Hopefully you can flavor it so that your child would still eat it.
Yeah, that makes sense. Okay. Yeah, no, I think that's great. And I know that this, having that potency, it sounds like it makes a big difference. So,
Right. Yeah.
And probably even better that you're what's in the yogurt. It's just, the whole foods as well.
Right.
So, yeah, that makes sense. So in terms of the fecal matter transplant, when do you foresee that becoming, more mainstream, or do you think it's going to be years and years down the line before we get more data on it?
Well, so the good news is there were all those studies, that are registered. So when I go online to say, what are the studies, and there's a bunch that are registered, so ongoing, but I would say a few years. It might, and also, of course, we have, it depends on what they find, because when I look at the studies, I know Dr. Adams did find really impressive gains, but then some other people that did some randomized control studies, but still with small groups, thought they didn't, they didn't find as much improvement.
Yeah.
They said there was improvement in sociability, but not necessarily language or cognition, or what we say a lot of the core autism symptoms. So I would say we're still a few years down the line for that, but that's why people could at least do start working on the microbiome themselves for the kids.
Yeah. Yeah. That makes sense. Okay, great. All right. And then how do you decide when to consider medications versus nutritional or microbiome based supports?
So because there's hardly any medications then available, so basically, I'm not a big fan of antipsychotics, but so when you say medications, the only ones, I do use pharmaceuticals in working on the gut, so that would come into play. I would have done like an oat. I like to do an oat by mosaic on most of the kids. So and that can capture certain metabolites in the urine that are actually from the gut, and show me if there's too much of a certain bug called Clostridia, or too much yeast or candida, or even mold. And so I would be using, if I'm doing gut work, or if someone has a parasite, if I've done a stool test and there's a parasite, which people can have parasites and not know they have them. And especially the kids with autism, unless if they traveled and then had terrible diarrhea, you would probably know they might have something. But I've seen kids that they swim in public pools and they swallow water and they get parasites. And that's actually happened, and that was the only thing I could figure out, people that haven't traveled. So I do use antibiotics and antifungals if I'm working on the gut. So because you have to get rid of what you don't want to be there before you replenish what you do want to be there. Yeah. So that's one class. But in terms of for autism, the antipsychotics would be for irritability. And that would, for me, I would only use it in a severe situation where I couldn't get rid of the irritability by all the, normal ways of working on the gut, bumping up the zinc, working on methylation, which is, we do methyl B12 shots. So there's a whole bunch of things that I would be doing. Yes. If the family was not sleeping, and I've had that in one child, well, more than one child, there could be a place for a really low dose of, say, risperidone. So I guess, severe irritability, head banging, not sleeping, I might use a low dose of that just to calm things down while I'm working on everything else. But I wouldn't start with that usually. Leucovorin, so that used to be kind of down the line because people weren't familiar with it. So they weren't, if I said, do you want to try this cancer rescue drug? They're not like, no. I had to talk them into it, which it's not my job to talk them into it. It's my job to present them with everything that's available. So we wouldn't get to that for a few months. So I would have offered that later and in the treatment. Now everyone wants it, so we start it right away. The order is, as long as we get to everything, I'm happy. If if parents want to start it, as long as they're willing to get the B12, and I do ask that they work on the diet, and then we gradually work on things, but we're just starting with that because they're excited about it, and they're seeing, most of my patients are seeing improvements, and many of the kids, the parents hadn't really seen improvements for years. So they're pretty excited about just even small gains in language or cognition.
Yeah. Well, I mean, those small gains lead to big changes over time.
Right.
So, the greater awareness and ability, it just builds on itself.
Right.
So it makes those therapies more effective too.
Right.
So
Right.
yeah, that makes a lot of sense. Well, and right now it's a lot of, when you're trying these things, it's a lot of trial and observe, right? I know you do mention that you're doing the blood work and the testing as well, which is great that you can you do kind of a combo of, is that right? Of kind of noticing the changes based on parent report and then also the blood work.
Right. Well, certain interventions, there's definite blood work. So for instance, that low zinc, I do, eventually I always start by giving zinc. So because everyone's low, I've never seen someone not be low that in my population that I'm treating. Then I circle around and we test, because some kids need somehow huge amounts of zinc in order to reach a normal level, and others need just some zinc, and you just can't tell. So you have to gather. So that doesn't, even if the child is better, it just seems appropriate to test that. Now, with the leucovorin, it's said that you really shouldn't go off of the leucovorin if you still have the antibodies. So even if you didn't test before, if the parents have gotten a really good result, but maybe it's a year later and they say, well, can we go off of it? You would want to retest. Yeah. Because if you still have the antibodies, you probably don't want to go off of it. Especially if you've seen a good improvement. If you've seen no improvement, that would be a different story. So certain things you're going to work on just on the basis that we know it's not good for the body. Like, we're going to try to treat things that we see, but then other things. So the leucovorin is one instance where, 2/3 of the kids improve, but there's not a marker for that. So we really try to just observe closely and, with language, cognition, receptive language, and see. So there is no marker for that. Yeah. You could have theoretically, if you have the antibodies, one would think you would improve. Maybe you need a higher dose. Hard to say. And which is another reason to test at some point, is that if you have the antibodies, you're not improving, maybe you need more. But if you don't have the antibodies, maybe you're in the group that is not going to improve. Not everyone improves on leucovorin. Yeah,
that makes sense. Yeah. Well, the testing sounds like it's super helpful. I know. I wish it was more accessible for everybody to access through insurance.
Right. Yeah, well, you have to have a practitioner that will order it. Yeah. Is the other thing. So if I don't think the pediatricians will order it. So again, that you've got to be with a neurologist that is willing to order it, or a developmental pediatrician, or an autism doctor who's willing to order it.
Yeah. And what is the name of that test again?
That's the FRAT test.
The FRAT test. Okay. Yeah. Okay, great. Well, if there was kind of one thing that you would recommend for families, given all of this information, I know it's so, individualized for each family, but, if there's one thing for families to start with, what would it be?
Well, I think I always start with the multi-powder, the spectrum needs. So do that. I would order the Tiny Health, and because you can order it yourself, and then you can actually do some of the interventions yourself. because they tell you what to do. And then for the leucovorin, you really have to find a doctor. That there are naturopath doctors that also prescribe leucovorin. So it doesn't always have to be an MD, or there could be nurse practitioners, but you have to find someone that will prescribe it and order the frat test. I guess that's more than one thing, but the multi and the tiny health, those are high on my list now.
Yeah. Those are great. Yeah. Just tangible things that people can look into right away. Yeah, that's fantastic. Well, this was fascinating, really interesting. I really appreciate you being on again with us today and sharing more, and looking forward to what's to come in this field. And, it's great that people are really talking about it more. And I feel like at least that the community at large is talking about it more and researching it. So it's very exciting. So thank you so much, Dr. Lisa, for being on and sharing this information and all that you do for this population.
Sure. Well, I wish there was more research for leucovorin, but because I wish everyone could have access to it. That's a good candidate.
Well, hopefully one day, hopefully it'll change, as people are starting to talk about it more. And, it seems more commonplace, that people are talking about, which is progress.
Right.
But, yes. Well, fantastic. Well, thank you again. And I hope you have a great day.
Thank you. You too.
I'm dancing on the edge again. The wind is calling my name. I'm dancing on the edge again. This time I'm not looking back, babe. You can change me, you can tell me down. I'll leave echoes in every place I find. I break the molds with rebels mind. I'm a hurricane of free, holding mine.
The information provided on this podcast is for general informational purposes only. The content shared is based on the experiences, opinions, and perspectives of the hosts and their guests, and should not be construed as medical advice, diagnosis, or treatment recommendations. The discussions and topics covered are intended to foster understanding and awareness of autism therapies, but are not a substitute for professional medical guidance. Before making any decisions regarding therapies or treatments, we strongly encourage you to consult with a qualified healthcare provider who can provide personalized recommendations based on your unique circumstances. By listening to this podcast, you acknowledge and agree that the hosts, guests, and producers are not responsible for any consequences, damages, or outcomes arising from the use or application of any information during the show.